Hello and welcome, everyone. Today we're doing our spotlight on CIL with Carolyn Grawi, our Executive Director. She is going to tell you about herself and what she does with CIL. We're going to have a question and answer period when she is finished speaking. So any questions that you might have, please be sure to type them in the Q&A box, which is located on the toolbar, either at the bottom of your screen or at the top of your screen, depending on what your preferences are. There is closed captioning available. You can click on the CC closed captioning button and choose the options on how you want to see that. So be sure to type your questions in the Q&A box, and the chat section, we will put some contact information in there, and if you have anything that you want to put out there to our participants or our panelists, please be sure to put it in the chat. Thank you so much for joining us today, and Carolyn Grawi, take it away.
Hi, good afternoon, everybody. Thank you for joining us today, and thank you, Joanne, for bringing us forward. And we'll go ahead and go right into the slideshow, and when we get back to Q&A, we can probably come back to, I guess, to this screen at that point. Thank you. So welcome again, everybody, to our spotlight on, actually, Joanne, can you go back one slide for a moment? So this is a spotlight on the Center for Independent Living, and what we do is we partner with and on behalf of people with disabilities to help each person reach their goals. We also partner with community, organizations, families, parents, all different entities, but in the end, the goal is that it is the individual's goal for a person with disability to be successful throughout our community. We'll go to the next one. And so I am very fortunate. Again, I'm Carolyn Grawi, and I have been associated with this particular Center for Independent Living since 2018. And I've been associated with Centers for Independent Living back to 1987. And I have been very privileged to be able to gather an education, to be able to have supports and services related to my disabilities. And I've been able to do all those things because of a lot of things related to Centers for Independent Living. And so one of those pieces that you will get to hear through my story, and then also as we go through our general slideshow about the Center for Independent Living, is you'll see how you or others you may know or people who you may meet in the future could benefit from having services through a Center for Independent Living. So I'm going to share a little bit of my path to the center and my path as to center leadership, and also about community engagement, because none of us are here by ourselves. We are all part of a much larger network of individuals who impact our lives on a daily basis. And so being able to know where those resources are and how to utilize those resources is really important. And that's something that happens at every Center for Independent Living. Ours here in the Panhandle, and if you were to go to any other center in Florida or across the country, a lot of these pieces would be the same when you go to different places in different parts of the country. Of course, we like to say that our center is just wonderful, and our center does more than any other center could possibly ever do for you, because we're right here, hopefully, in your community. Not that any of us can't ever improve. I am all about learning, and I'm all about sharing, and I'm all about helping others to do the same. So my path to the center leadership here is that many years ago, I was diagnosed with diabetes, and I was 10 at the time. Had no idea how my life was about to change. But I remember with my family that when we went to the doctor, it was shortly after the Kit Kat candy bar had come out. And all I wanted to say is, can't I have another Kit Kat before this all has to start? And the answer at the time was no. Of course, a lot of things have changed since back then. I'm still a person with diabetes, and I use the insulin pump, and that's how I'm able to live my life as successfully as I feel that I can with my diabetes. And I also have something that is my more prominent disability in my viewpoint, which is my visual impairment, which is actually secondary to the diabetes. but it happens to be for me what is my primary issue, which is that I am legally blind. And so it impacts a lot of different parts of my life. But at the same time, because of who I am and how I was raised and all the opportunities that are available for all people with disabilities throughout the community, I'm able to put some of those pieces into action. And I try to have a really positive attitude to be able to do more things productively going forward. And so when I was in college, that's when I found out that I was becoming legally blind. And I had to learn to be effective in different ways of doing things. And so at that time, I learned about large print, and I learned about what a Center for Independent Living was. I got in touch with my local center. I got to talk to some people with some peer support about what was their life like with visual loss. I learned about all the other kinds of resources that were in our community available to people with disabilities. Some of them I chose to use right away. Some of them I chose to ignore. Some of them I needed. And I found out later how to get back in touch with them and ask those questions and make those next steps to those resources. And then I was able to finish my master's degree with the vision loss. And I was able to go on to be a social worker. And I've been a social worker now for over 30 years. And I also have been fortunate enough to be a very active community member. And I've worked with Centers for Independent Living. As I was saying, my association became with them in '87. I've had lots of other kinds of jobs and things that I've done too, but always seemed to come back to something that was very important and near and dear to my heart, which was doing things that help others and doing things that help make things in the community right. And is everything right, the RIGHT right? No, but we can always keep working towards improving that. Each of us has that control to do that. And so I have been very fortunate. As I said, I worked very hard over time, had resources available to me through organizations, and was able to get those supports that I needed in order to participate. And in doing so, moved my ranks up throughout the organization that I was involved with, which happened to be in Ann Arbor, Michigan, Go Blue, and became their executive director. And then when my child decided that he wasn't going to be in school in Michigan, I decided it was time to warm up for myself. And here I am in Florida in Pensacola. And our center here covers from Escambia County to Walton County. And I am here in the Sunshine State, hoping everything can be better and more sunshine for all of us. And so we're going to go ahead and learn some more about what is the Center for Independent Living, because those are ways that I became a leader, and there are also ways that you can engage with us. So we'll go ahead and change to our next slide. So a Center for Independent Living works with and on behalf of people with disabilities of all ages, all backgrounds, all portions of the community, all income levels, all races, all religions. Any point in time that somebody may experience a disability, we hope that they will be in contact with us here at the center, because we know it can make a difference in their lives. And when we say we know, it isn't just that we know as a by ourselves piece, but that we know because it's been history. Centers for Independent Living have been around actually since the 1970s, early in the 70s, and our center's been here since 1980. And our center works very hard to provide support, to facilitate trainings, to give opportunities in the community. We work so that we can help individuals to have their best chance for success at home, at work, at school, and in the community. Sometimes it's just a hello, we're glad we know that you're there. Other times people need specific resources, and other times people need opportunities to enhance their skills so that they can carry on living independently or being functional at school or in college or at work. Any way to make the community a better place for all of us. We all do it together. It's not a one person does everything. We work together to make it better here at our center and out in the community at large, and with the other centers for independent living here in our state and in our country. You can reach our center, as you can see at the bottom of this slide. It's on throughout most of the slides. You will see our center's phone number and our website, and that's a good way to stay in touch with us. If you haven't already done so, Joanne will probably do a reminder about this at the end, but you're welcome to sign up for our newsletters. You're welcome to visit our website anytime. We welcome your participation with us as we work together for your well-being and the well-being of all community members in making the Center for Independent Living able to support and work with others to make our future even better than it is today for tomorrow and ongoing. So we'll go to the next slide, Joanne. Our reality is that people with disabilities have a lot of areas that we don't have the same opportunities or the same programs that were available to others at some point in our lives. We have about, I think on this slide, we have the number, and I'm just looking for because I want to verify it, that we have about 77,532 people in our 4 counties who are potentially people with disabilities who may at one time or another benefit from having a resource available to them. And in that 4-county region, there are different access to services that may take place in each one. And so when you are a person living in any of the counties, you can reach out to us and we're going to want to make sure we help you to find those resources. Or if you find a resource that you think is going to be beneficial to us or the community, we want to share that resource in our newsletters, through our trainings, etc. So we welcome your engagement with us. We think that we are our local experts in CIL and in disability. When we say local experts, it's because we have many years of history. But that history grows every day with every single one of you. And no one can be the expert on every matter, but each of you have your own expertise, especially about yourselves or the work or the engagement that you've done in the community. Something that we do know, however, though, is that people with disabilities are more likely to have trouble with transportation, more likely to have trouble related to getting access to a job with gainful employment, more likely to have to make choices because of their household income. That's household income with benefits or household income from jobs or household income from family, but where they're more likely to have to make choices about how they obtain their services. Sometimes they can't follow the things that may be best for their disability or for their future or their education or their transit because they're balancing on a very small income the amount of items that need to go through and be processed. Many people with disabilities have less than $15,000 a year of income or of benefits that they receive. And when that happens, the choices get harder. And the less you have, the more frugal you have to be with where you make those decisions of where things are at. So another way that centers are able to help is to sign up for those additional benefits or be able to look for new avenues of seeking funding, seeking education, seeking opportunities, being able to help us to meet some of these areas, helping to have individuals with disability to not be isolated, to not feel like they're the only one, to know that there are other people out there that are living and practicing their lives as successfully as they are because of the resources in the community. And sometimes it may be that somebody has limited resources, but because they're able to access the services, all of a sudden their life is very full. Or because somebody who maybe has lots of resources doesn't know how to access the services that they need, their life may seem very sheltered or very cornered or separated from the rest of the community. But by being in touch with us at the CIL, we can help to make these things grow and be opportunistic for where we go next. And we're going to go to the next slide, Joanne. At Centers for Independent Living, we have 5 core services. And in those core services, we look at various aspects. Almost everybody who comes to us is starting at information and referral. Maybe they just found out our phone number or our website and they call us and they begin with one question, or they might begin with dozens of questions. Either way, we're happy to see you, happy to talk to you, whichever way it may be. But that's called information and referral, where you make that phone call and maybe we give that first answer to you or that first link to a resource. And that might be all you need, and that's okay. Or there might be lots of those kinds of resources that you need, and maybe there's some building blocks that we need to do in between. So then we might move to the independent living skills trainings or learning and talking with somebody else about what some of those skills might be of where you're going. And then we have peer support, and that's where all centers are alike in the sense that we all have 51% or more of our staff and our board are people with disabilities. And so when we have peer support and people who may have gone through similar activities of what we have done, then we are able to help build on that. Sometimes it's the same disability and that somebody experienced it before in that transition. Sometimes it's that they want to do the same kind of activity, but it's not the same disability. But again, other times it's because we've been in the Center for Independent Living for a while that we know who to send you to or to share you with or to partner you with your permission, of course, in order to make things move forward. And then we have advocacy, and in advocacy, that's like the key one for me. I'm all for those rights, and I'm all for making sure that everybody has those opportunities. It might be individual, it might be systems, and we're going to go through some slides where you're going to see a little more detail on this in a moment. And then the fifth core service is transitions, and that can be transitions, it can be youth, it could be adults, it could be diversion from an institution, it could be returning to the community from an institution or from a hospital. So there's all different ways that it may work, but we're going to now go to that next slide, and we're going to briefly go over some of these pieces, and we're happy to make all of these slides available to everybody in the community who would like them, because of course we want you to have this access point available to you. And so as we look at information and referral, it could be accessibility, assistive technology, benefits. It could be that it's related to education, housing, legal. It could be examples of transportation need. Maybe you had transportation before and something's changed, and now you need to find out information about how to access that. It could be pieces about getting prepared for an emergency. We know here in Florida, the one emergency one that we constantly hear about is, of course, hurricanes. But we've all been dealing with the pandemic of COVID. And so we've all been dealing with that emergency. And then it could be that you have an impersonal emergency. Maybe funding has dried up, or maybe the resource for medications isn't available to you, or maybe something happened and when you tried to renew a benefit, now something's different and you need to figure out what that next step is. All of those are parts of being prepared for an emergency and being able to know then how you're going to take your next steps. And there's so many more other kinds of things that people may call us for, that you may have a new one that comes to us and we may say, you know, we don't know about that one, but we're going to find out and we're going to get back to you on it. Or it may be that we have that answer and we link you right then and there and you say thank you and you don't need anything else. But you may like to go on our newsletter list like we spoke of earlier, because then that way, as new information comes about, you could be involved too. We're going to go to the next screen. Here are just a picture of some success stories of folks who have been with us. We have a 12-year-old at the time, of Caleb, who his mother could no longer pick him up to do the transition services that he needed because he was growing. He was becoming a young man and needed those supports. We were able to assist him and provide a Hoyer lift, and in doing so, his mom is able to safely transfer him, get him where he needs to be, and also not hurt herself. What a win-win combination in order to be able to do things without causing harm to somebody else. Then we have a picture of several different individuals who are getting mobility devices. And in those mobility devices, you can see there's walkers and a wheelchair. One individual is much taller than the others. Getting a hold of that larger walker isn't always so easy. Being able to have one that is a rollator that has wheels and a place to put things is also something that can help for somebody's balance and somebody's being able to take things with them. And so that's an important piece. And we have an individual here on the end who at the time, her power wheelchair, who had stopped working, but she loves to garden. And it was right in the beginning of COVID. And we were able to send to her and have somebody from our team bring out to her a manual chair so she could continue to be involved in the community. So she could do some activities while she was now at home and not in the community because of COVID. And she's a wonderful woman with lots of positive spirit, has dogs that she cares for, is able to have individuals who do come sometimes to assist her, but at other times she can go in her garden herself and have all kinds of wonderful fresh fruits and vegetables that she's growing herself. And then up in the top corner, you can see one of my team members is working with a woman who was looking at having a phone for being able to communicate with folks. And that one is through our FGRI program, which we'll also mention towards the end, but that's the Florida Telecommunication Relay Incorporated Services. And it's another way to have access to things in the community, because with that support, she can hear things, or she can see a caption that might be on the phone that she chose and be able to follow what is shared. We're going to go on to the next slide. So independent living skills and building topics and trainings, we want to build those skills that people have. We want to give trainings to the wider community, just like you're here today. Or it may be that you yourself have an individual need, and we sure hope that soon with COVID, we will have doors open. We'll be back to having people in person. But in the meantime, we're having Zoom. Sometimes we're meeting with folks in our parking lot. Sometimes we're meeting in driveways. Sometimes we're meeting by public libraries or at parks, different kinds of places to make sure that those skills are available. Sometimes it's around decision making or problem solving. Sometimes it can be about finding out where is the next steps I need to take to be more successful with my own disability. Sometimes it can be all kinds of areas that you may be benefiting from. Sometimes it's transitioning the skill that you have a strength in to help you to build a skill that maybe is one that needs to be strengthened, to be having you have more opportunity to live independently, more successfully throughout your life. It could be all different kinds of things. But we try to make sure that you have that access to taking those next steps to being the best that you want to be. Again, it's your choice. They're not our goals, they are your goals. And we help you to try to find your way from A to B in achieving that goal. Sometimes we have to go A, C, D, F, Z, then get to B. It's not always a straight line from A to B, but we will help you to find that path that is the goals that you want to set to live as independently as possible as you might like to. We're going to go to the next slide. So peer support and counseling, we have two different ways that we talk about this. We do a lot of individual one-on-one peer support that comes from us as a team, but also each of you out in the community are peers. You're all part of that successful model of being able to help each other out, because we all have our own best expertise in what we know. So we sometimes have a monthly peer group that meets to watch for our date and times of that event, as well as we can match an individual peer that we were talking about earlier. But when we can rely on each other as the strength of those services that we had before and those services that we might like to find out about, or to be in numbers to say, hey, this is important to us. Hey, Center for Independent Living, we want to do this social activity. Or Center for Independent Living, we notice there's a bad ramp out here that then we can send over to our advocacy group. We can help to share those things through our peer support of one another. When you find or see somebody who might be having an issue out in the community, you might say, hey, I know you can get that support over at the peer program at the CIL, and it can be shared that way too. And so there's ways that we can do it, whether it's yourself or another person in the community. So we're going to go to the next slide. For individual and systems advocacy, as you can imagine, when we say individual, that sounds like it's more one-on-one. And systems advocacy is when we're working as a group. What we try to do is look at ways that we can have the community come together to change things to make sure that people have access. So I already was just speaking to you about the ramp for a moment. Imagine if you were to go across town and you have a ramp here and a ramp there and a ramp at the next block. And when you get to that fourth block, there's a curb and there's no ramp. How does a person with disability get over to that business if they are using a wheelchair? Or if they have a balance issue and they can't climb the step to get up of the curb? Well, that's a problem. And so we try to work very closely with our cities, our businesses, our state, even nationally, to make sure that things have access for people to participate in. Sometimes it may be that an individual is having their own concern that might be at a doctor's office. And maybe they're not having an interpreter that's being provided at their doctor's office. Or maybe they can't get the prescription that they're trying to get, which is what they need. And they need assistance through working with the pharmacies to try to find it at an affordable rate. So we might be advocating for the individual then. Sometimes it's related to Social Security or other benefits. Sometimes, again, it could be one-on-one, or other times it could be as a group that we need something. And so, for example, if you happen to live here in Escambia County, previously to 2018, people with disabilities couldn't travel across the bridge independently. Now, because of advocacy work that was done, and I'll say it was done by me in that one, I brought some people together and I talked about it with our transportation company, and I said, my taxes are being paid for access to services all of Escambia County, not just here in Pensacola or not just over in another community, but all of it. And Pensacola Beach itself is part of Escambia County. And so we were able to work with our transportation company to make sure that Escambia County's ECAT transit services provided paratransit services across the bridge. And it's so great our bridge is back in general, so we can get across more easily. But that would be an example of, I personally wanted it, and so did the community at large, and we presented it, and we were able to move that forward. And so that's an example of a systemic advocacy. And so we really want to be here for you in the community. We get involved with park renovations. We get involved with access to individual education plans. We get involved with all kinds of pieces that may be from the ages of 0 to 100 or further, because now everybody's living longer, thank goodness. But it doesn't matter where you are in your stage of life. We want to make sure that you have those successes available to you for those opportunities so you can have those successes. We can't determine your success, and you may not alone be able to determine your success, but together we can move that progress point forward. And when we do that, then we're doing it together, and we can all be happier and all be more engaged and all be able to do more things as we move the community to be more inclusive, accepting, and equitable for each of us to have those opportunities. Sometimes we need exactly the same thing, and it's equality. And other times what we need is a way to participate, and that would be more giving us equitable chances to do the same things. So there's different kinds of ways that we approach that. It all depends. But if you're in contact with us, we'll be certain to try to help you find that path and that journey to where you want to go. We'll go on to the next slide now. We shared earlier that we have transition services as a 5th core service. Most of those 2 areas of the transitions and diversions are highlighted in 2 areas. A lot of them are with youth, which are a lot of times those transitions between time periods of school. And one part that's part of WIOA or WIOA, it's the Workforce Opportunities Investment Act. And in that act, we are able to help youth in transition be able to have supports so that they can come and be part of the workforce by being able to have those supports and get those accommodations to learn those skills and be able to participate in the workforce. Some of that youth transition, though, is also learning about, what do I need to live independently? How do I balance my money? Similar things to some of those IL skills. How do I hire my own personal care attendant? Or how do I get transportation? How do I ask for workforce accommodations? I already started to tell you, and other pieces. Some of those things are also for adults, but we find for youth, and that's where that act came from, that a lot of times that transition time period from being at home with family or being in foster care, or sometimes even being in an institution, but now you're coming back out to the community as a young adult, those pieces that are there are needing some reinforcement. And then for adults, which is everybody else after you're age 18, if you're already a person who didn't have a disability, or if you are a person with disability, the federal government recognizes you as a youth or a young adult until you're age 26. So after 18 or 26 or somewhere in between, depending on what age you are at the time, you become an adult getting services from us. And we have community transitions. And those transitions might be that assistive standpoint in order to be able to help you to get the services that you need to stay out in the community or to return to the community. Or it might be diverting you from going into a hospital or into a rehab unit or into a nursing home, or if you were a person who happened to have had some other point in your life that you ended up in a correctional institution and now you're trying to come back out, we want to help make sure that that person has those resources to transition and be successful out in the community. And of course, if God forbid we have a hurricane in this area and you happen to end up at a shelter, we don't want somebody to say, oh, you have a disability now, you need to go to a nursing facility. What we want them to say is, oh, you have a disability, let's get in contact with CIL and let's see how we can help streamline those support mechanisms so that you can find your way to staying either in your own home or moving to a different environment that would be successful for you, but the one that you choose versus somebody placing you somewhere that is not what you wanted. And so that's the whole piece of transition, is to make sure, again, some of those choices that are made for you are you're making those choices, not the choices being made for you by us as the staff or by some other systemic entity. And that systemic entity can sometimes be our parents. Our parents or our family usually have really good hearts and big open wide eyes and want to see the best for us. But sometimes they also can keep us from being able to make our own best choices for us. And so we need to be able to say, it's time for me to learn how to do something, or it's time for me to go to somebody else to get to my next step. So as you can all see with some of what I've already shared with you, I have a lot of passion about CILs. I have a lot of passion about people with disabilities, people being able to make their own choices. So we're going to go to the next slide. In that youth transition one, I'm just going to share with you this a little bit more, that we have youth transition programming that goes on right now. You can refer yourself here. You can have your family refer you. Your teacher can refer you. Vocational rehabilitation can refer you. If you would like to participate and you're in Escambia County, we already have the funding set up for you. If we don't have the funding for you, we are going to find out how we can get that to get you these services so that we can move forward. But your vocational rehab and Division for Blind services are two of your largest areas of where funding can come to the center to help you get these services. But you have to choose that's what you want. And again, for the transition services, you can still self-refer yourself here. We will help navigate what path and where you're going to travel. But here you can see a group of students who were in our conference room a couple of years ago. Of course, we're saying a couple of years ago because now we've been in COVID, and they were learning some things. We have a student who came with us to Tallahassee, and you see myself there with former Representative Frank Wright and the student, and he was able to tell the representative why things were important to him related to CIL or related to youth with disabilities here in our communities. And then in the lower corner, you see another student there working with another one of our staff, learning how to use the computer system to do some programming for him to be able to obtain and sustain some job opportunities that were out in the community. And he happens to be deaf, and he's there working with an individual who is deaf so that they're able to communicate clearly what some of the pieces are that he was working on at the time. So we'll proceed to our next slide. So there's a lot of strengths that the center has. Of course, some of those strengths you've been hearing about, and other ones are ones that appear on the slide. And those are really important pieces that we have going on for us, because we are able to make a difference in the community because we provide services as people with disabilities to people with disabilities. That includes helping individuals to find and improve the quality of their mobility devices or equipment that will help them to stay independent. We have AT equipment through our FAST program where you're able to try things before you buy them. We're able to help provide phones through the FGRI program, like we said. We are also able to help working with individuals so that they can decide what they need for wellness in our community, so that they can live the most successful, safe, healthy life that they choose to be able to make those choices as they move forward. When we talk about the goals again that we're working on, they are your goals. So we may list lots of things that we see as our strengths or that we see as opportunities, but you may have other ones. We want to hear those. And we couldn't possibly be in this presentation put every single thing down, but we're trying to highlight some of the larger ones and some of the areas that we're able to work on things. We're going to go to the next slide for more of our strengths. So we've been here for 40 years doing the work that we do. We hope to be here another 40. We hope to be here for as long as you need us and the community needs us. As I always say, as a social worker, I would love to be put out of a job. And when I say to be put out of a job in that phrasing, is that everybody has everything that they need to be the most successful self they can. Can we get there alone? Absolutely not. We need the community support. We think that you are likely to need the community support and need our CIL support, but together, again, we can get from point A to point B, however that route and that journey may take. We provide high quality services. When we are working with folks, we have on our consumer surveys, 100% of the people are satisfied. We have 97% of the people say that they're very satisfied and 3% of the people that say that they're satisfied. We think that's pretty good. We think that's a great place to be and to keep moving forward. Another area that we look at a lot is being able to have people with disabilities be assisted by people with disabilities. Here at our office, while we're required under our federal contract to have 51% or more of the people be individuals with disabilities, we have about 85% of our team and about 65% of our board who have disabilities. And when we look at that, that number is always changing because we have new staff or we have change in staff. We also have change or new board. But the idea is that we ourselves are experiencing those pieces and being able to share it with you and with others, be able to ask the cities, the counties, the state, the transit, the housing, et cetera, for some of those pieces that we think help to make the lives better for us and better for you and better for others, which means it makes it better for the community. We're going to go to our next slide. What we have right now is we feel like it's our time to celebrate. We're coming up on 41 years for ourselves, 31 years of the ADA. That's something I didn't mention earlier, but I've been involved with the ADA since its inception. I worked back in Michigan with John Dingle on part of the ADA, and I also have been an ADA coordinator since 2012. That's when it became official that you could be an ADA coordinator. There's daily trainings. All of you out there are welcome to get involved in those trainings too. There's a lot of trainings that are available through one of our partners, which is our local partner of that is the Southeast ADA Center. There are our ADA centers that are across the country. There are CILs across the country. I don't think I mentioned that earlier. We are one of 15 here in Florida, and there are about 600 in the country, and there are 10 regional ADA centers. And so that's some other ways to get involved. But during COVID and during the last year, as we're trying to celebrate getting things back together, and as we move forward, and as we know that we're able to, we are always engaged. We are always committed to being as involved, and we know that we are essential. We know that when you come to us and that you work with us, you're going to hopefully be on that next step forward to where you want to go, whether that's rolling a step, whether that's pulling something down, whether it's creating something new that you envision out of the sky, or it be that we are working with something that we already know front and back and forward and upside down. But we're here. We are always here to help. That's what makes the difference in what a CIL does. There's ways that you can get committed and be involved. By being able to donate to us, we are able to make that connection going forward. So one of the things for the entire month of July, of course, is that we are working on this fundraising campaign. Sometimes people are able to be involved and aren't able to give dollars, but are able to connect us to people who can give us dollars, or who are able to be involved when we do need help that is not financial. So we invite you to be involved with us in that way. You're welcome to look at our website. You are welcome to text to us, CIL always, and the text phone number is 44321. And of course, if you visit our website, you can click there. And if you choose, you're able to mail stuff to us. And our address, we're at the corner of Herman and North Pace. Our address is 3600 North Pace Boulevard, and we're in Pensacola. Florida at 32505. And I'm proud to say to you that we're already at over $1,000 of what we've earned so far this year in this particular campaign, which is our summer campaign, which is about anniversaries of the center and the ADA. And the ADA gives us access federally in law written, but all of us as a community make that access by our attitude, our engagement, our involvement, and what we do at our businesses and our locations. And when we take that positive attitude and share it and make it possible, then all of us are successful. It's not one of us, but all of us. I'm going to transfer things back over to Joanne for a moment, and then I'll be happy to answer any question that any of you happen to pose today. So Joanne's going to forward to the next slide. Here we go.
Hello, everyone. This slide is just a summary of all of the services that Carolyn had talked about. It highlights our 5 core services again: individual and system advocacy, information and referral, independent living skills training, peer counseling and mentoring, and transition services. It also talks about our other programs. Like Carolyn mentioned, we have our phone program with FTRI, our assistive technology offerings through FAST. We also have our durable medical equipment and our support groups, our community education and training. So again, our address is on North Pace Boulevard in Pensacola. Our telephone number is 850-595-5566. And you can visit us at our website at www.CILNWF.org, or send us an email to our info, info@CILNWF.org. And now we come to our question and answer period. So please type your questions into the Q&A box, and I can field those to Carolyn, and she will do her best to answer those. And also, a recording of this presentation along with the slides will be available on our website sometime soon, along with a transcript of what Carolyn talked about today. So feel free to type your questions in the Q&A box, and we will field those. Let me see what we have in there, Carolyn. What is the first step that someone would have to do in order to get services started?
All they need to do is either make that phone call to 850-595-5566 or send us an email to info@CILNWF.org. We would be happy through our information referral to start getting you connected to the different services available. What I didn't share, and I apologize to all of my team members, including Joanne, who's on the call, all of this is done because we work collectively as a team. So when you call in and you speak to whomever happens to answer the phone at that time, that person may connect you to others in our team, because there might be something that Carolyn's the most knowledgeable on, or that Joanne's the most knowledgeable on, or Danny, or Karen, or Susan, or Brett, or Cherie, or Debbie, or Di. Karen, or Tavara. I think I said everybody. Susan. I'm not sure if I said Susan that time or not, so I'll say her again if I didn't say her already. But that was just off the cuff, naming our team members. And we try to make sure that everybody gets the services that they're looking for, and help them if for some reason that service isn't available or isn't there, to get to them to the next step. But it really starts with just that phone call or that email, and we're happy to have you engage with us.
Another question that we have, Carolyn, is about advocacy. Someone's wanting to know if they need help applying for benefits. Is that something that we help them with?
Absolutely. And sometimes that advocacy requires Joanne, who's our advocacy coordinator. And sometimes it would be done for some of the applications through our independent living skills team members, such as Danny or Karen, or through our current information referral person, Tavara. It could be done at different points and stages. Sometimes there's connections that happen through Susan in the FAST program. And it just depends on what's going on and what's needed to who will do it. If for some reason you were denied a benefit, let's just say it was Social Security as a piece, as an example, then that one would most likely get kicked up to Joanne, who is more our systems advocate. I also can answer lots of these questions, and so can Debbie or Di, but the piece is that we try to share some of where that workload is going to, but all of us want what you want to be the most successful that you can be. And sometimes we get that answer right away. Again, we don't control the federal government. Other times we have to keep hammering at it for a lot longer. And then sometimes it will then come around. Sometimes it's just been simply how somebody answered a question that maybe you answered the question truthfully, how you answered it, but it didn't take into consideration what the question was implying for that benefit that was needing to be known. So it really depends. I know that's not the answer some people like to hear is it depends, but it depends. It's kind of sometimes what really happens is that things are different at different times.
We have actually two people asking, what's the fundraising goal for this year?
So our fundraising goal for this year is $50,000. We would love to bring $50,000 into our community to be able to do more things with people with disabilities. So we're at 1,000, and you and everybody you know out in the community and all the businesses and sponsors can help us to get to 50,000, to 500,000, to 5 million. We wouldn't say no, but we are working our way towards $50,000 this year is our current goal.
I think we can make it with the help of the community.
Absolutely.
That is all the questions that we've got. Carolyn, do you have some final comments?
Let me just say again that it's a pleasure to be able to present to everybody. I look forward to seeing you either here at the CIL or out in the community. And please make sure if you see me someplace that you say hello to me, because I already shared early on that I am legally blind. And if I don't see you or I don't say hello to you, I'm not avoiding you. I just really may not know that you're there at that particular moment. And certainly I always want everyone to feel welcome to contact the center. Again, info@CILNWF.org or 850-595-5566. And hey, check us out even before you call us if you like at our website at CILNWF.org. We look forward to meeting you, and I personally look forward to hearing about all of your successes with everything we do and ways that our board, our staff, our team can help you to be the most successful person, business, community that we all want to be as we move forward together.
Thank you, Carolyn, and thank you everyone for joining us today. Please check us out on our website for our other offerings of community education. Have a great afternoon.